Here. Commissioner Taylor.
Here.
Commissioner Spiz.
Present.
Commissioner Powell.
Here.
Commissioner Luce.
Here,
You have quorum.
thank you. Please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first order of business is approving the minutes from November 4th, 2025. I have a motion by Commissioner Spiz and support from Commissioner Taylor. All in favor say aye.
Aye.
Opposed? Our minutes are approved. The next item is approving today's agenda. I have a motion by Commissioner Taylor and support from Commissioner Spiz. All in favor say aye.
Aye.
Opposed? Our marathon agenda for today is approved. We've arrived at our first public comment. This is for any items on the agenda. If there's anyone from the public wishing to comment, you can come to the end of the table and state your name and community, and you would have 3 minutes. Seeing none, our first public comment is closed. We move into presentations. We have 2 today. The first is the Oxford After Action Report Final Summary. And looks like Tom Hardesty is here to talk about this item.
Good morning, Commissioners.
Good morning.
Thank you. Give me a moment to get that up. Thank you for giving me a little time here this morning. I will try to be a combination of providing necessary information and brief enough so that you can get through the agenda. All right, as you noted here, you see a big binder with me. That is the report, nearly 300 pages of a detailed after action from the Oxford High School tragedy. It's certainly important. There were a lot of victims that day, but 4 that lost their lives, with Hannah St. Juliana, Tate Meyer, Madison Baldwin, and Justin Schilling. So certainly, as it's mentioned in the report, this is what we have to keep in mind as we look to take what can we learn out of this to try to prevent, to have future victims in the future of this. So what things can we do to improve? The focus of this after action, I think it is important to know what the focus of this was, which was to look at the response, first responders, which includes law enforcement, fire, EMS, but we also wanted emergency management, crisis counseling, mental health. Let's try to look at all these. There's a lot of after action reports out there on unfortunately, a lot of mass shootings, but most all of them kind of stop when the shooting happens, and that's what they focus on. So we wanted to take a look at everything and what could we learn from the 2 years of managing this incident and learn from that. So looking at command and coordination, communications, including 911s, and interagency information sharing. As we all know, we're a county with a lot of communities, a lot of police and fire agencies, so communication is important. But look at our recovery efforts, including those with the mental health community and first responders, and the strengths and weaknesses in our protocols, policies, and procedures, and training for first responder and government entities. So I did want to take a moment to kind of focus and talk about what the purpose and the background of an after action report. We heard a lot of things, and many times when we were talking about after action, someone would throw out the word investigation. This was not an investigation. An investigation, you may hear about the Attorney General's office, may take up an investigation. An investigation is looking, there is generally, potentially, or even an allegation of some wrongdoing, and they're looking to identify, in many times, people or individuals that may have done wrong and investigate that and find out, what individual things, or was there criminal culpability there? This was not an investigation. This was a review of what went well, but how could we do it better? there's also a difference with a debrief. So many times, I spent 30 years in law enforcement. You might have a critical incident that happened that day. That same afternoon, maybe the next 24, 48 hours, those people involved from that law enforcement agency or fire department or even emergency management might kind of huddle up and do a quick review of what went well there, what could we do better. That's good, and it's important to get some immediate feedback, but that's not an after action. An after action is intentionally sometime after the event, and it's taken a deep look at every aspect of it. And again, the focus of this was not to find fault with individuals. It's not to try to say, oh, this person did something wrong. It's how can we improve? What are the absolute best practices for every little piece of this across the country and the world? What is the absolute highest bar for everything out there? And what could we do to try to get there? It's, I would say, impossible for every agency to be the absolute greatest at everything all the time. But that doesn't mean that's not our goal to try to get there. So that's what we're looking at with an after action. What things that have been learned since Oxford happened. There are best practices that have come out since then. So what are those that maybe we haven't seen yet for one of these aspects, and how can we seek to get there? What are those things that an outside firm looks at, and what can we do to get there? So those are the things that we're going to try to look at here today. The first one we want to talk about in areas for improvement was emergency management. The initial incident coordination liaison. So one of the recommendations that they made is that we have a liaison at the scene of major incidents. Now we have 5 what we call specialists, which are kind of the focus of running EM, along with Rob Seeley, who's the manager, and myself. Generally, our history has been that we would be at the EOC responding to requests for service. But in this case, we were struggling to get information. We couldn't get a hold of the schools. So their recommendation is that we send somebody to the scene to liaison with that unified command. There's a lot going on in situations like this. It's tough for a commander at the scene to take a phone call from somebody and say, oh, okay, I'm going to take a few minutes. So sending a liaison to the scene. We practice in the EOC, we have a layout for every position and 3 deep for every position, but one of their recommendations is that for certain types of known events, we kind of have a pre-sheet of which seats need to be filled. So that's one of the things we've started working on. All right, for an active assailant type event, which seats do we know automatically need to be filled? What are some other ones that might need to be filled? And I can give you an example of that. OCHN is now added for us for mass attack events like this. They have a chair in our EOC. They're one of our first contacts. And then develop a framework for a reunification and victim assistance center. And I'll touch on this one a little bit more, but it's a big one. And part of that is recovery. So one of the things they noted in there is the county in the EOC is there to provide assistance when needed. We don't have legal authority to make any community to do anything, but that doesn't mean we're not kind of in the best position to be the one to facilitate this. So their recommendation is that we take the lead on putting together a county-wide outline for Victim Recovery Center, Victim Assistance Center. So that's a process that we've started working through the framework of who would be the partners in that. It's not something we just write and hand to everybody, but getting buy-in from all of our first responders in our communities and working on that plan and helping guide with it. And then connections with schools. As I mentioned, it was 2 weeks before we could get in contact with anyone from the school administration to even try to let them know what resource and assistance we could provide. So about 1.5 years ago, the school safety director for Oxford Schools had reached out to Rob and I about wanting to have some meetings with her and her neighbors about school security. Well, that's turned into a a school safety committee that involves all 28 school districts and many private schools, both in the county and some surrounding the county, that meet on a quarterly basis. Rob has led this since it got going with representatives from the schools. We now have contacts from every single school district in the county that we can pick up the phone. They know who we are, we know who they are, and get through to them in an emergency so that we can help provide that assistance quicker, as well as doing things like workshops for them on writing emergency operations plans. So this is one of the benefits that has come out of this, is getting them. It was always a struggle. We tried for years to get inroads with schools, and we might make it with one or with two, but now to have every single school district in the county involved has been a really good thing. Some areas for improvement that they recommended for law enforcement: improve use of incident command and unified command. Fire, in particular, kind of uses an incident command structure regularly, but they use it for medical incidents, fires. Using it in this type of event and really following it is a challenge. It really takes an effort. So finding ways to improve that, which means finding ways to practice it ahead of time. Improve communications after entry into an active assailant. You read every after action report, not just on shootings, but on every event ever. Communication will be one of the top things listed as an area for improvement. It never goes perfect. They are chaotic events. Like I said, it doesn't, every single after action report for anything has communication as an area for improvement, which means we do need to consistently work on it and find ways to get better. What this one was pointing out was, once the shooter was in custody, that some communication there. And one of the things that made me think of is, we've funded active assailant training for police officers for the last 11 years. But that training often stops at the assailant is down. So how do we focus on that training for that piece after that then? Because the event doesn't stop then. You have victims that need to be attended to. There's always bad information going on, that there's multiple shooters or other things going on. So that continued education and training is important, because people will do what they're trained to do. And if we've trained them that the incident's over once the shooter's down, that's probably how they're going to react. So how do we use this to improve our training for that? And then it mentions develop protocols for school security and school resource officers. And this has been one of the topics of conversations in those school safety meetings, is how do we get, they don't have to be exactly the same, but how do you get consistency with them? One of the challenges for the sheriffs is they're policing multiple different communities. So they can't, if you have widely ranging policies from every one of these school districts and communities, that's a challenge for them to be able to stay consistent in their response. So working with these schools to try to get them to be consistent, which will then help the response. Dispatch, they mentioned change some protocols for ascending fire and medical to active assailant events, particularly when multiple victims or assailants still on scene. High-risk occupancy locations such as schools or hospitals. If there's a threat of explosives, fire, or chemicals, just automatically sending them, and any hostile or mass casualty events. So those are some recommendations they've made for dispatch. And then an update to the CAD system. As you all know, Clemens is spinning off from the county, and my understanding is part of that is trying to how do they get quicker updates for software and move these things ahead quicker than they've been able to in the past. For fire and medical, some of the areas for improvement that were mentioned, again, improved scene command and communication. There were some challenges. One, within Oxford Fire Department itself, but again, you had multiple fire departments responding in mutual aid. So how do we improve that communication? How do we make sure that everyone's on the same, in the proper radio channel? It changes sometimes when they get on scene because there's so many people there. excuse me, so making sure that those things are done. So there were recommendations for fire and for dispatch on how that we make sure that is done. Improve staging protocols, not only for Oxford, but all fire departments. So we've seen over the years active assailant events. For the first active assailant event changed law enforcement response from waiting outside for a SWAT team to going in. Aurora changed fire response a bit about how do we look at fire integrating with police to get to patients. And that's what they're talking about here is every fire department has their own staging policy. Some stage outside until it's safe. Some have had rescue task force training. Some have had some training but haven't had a chance to train with the police. So, and there are some new recommendations coming out about instead of staging fire trucks, for example, a quarter mile away and wait until it's safe, do they stage them at 4 corners? Because in a mass event, people are gonna evacuate in all directions, including injured people. So there's a lot of different recommendations out there, so trying to take a look at those. Again, CAD software, it was brought up, and increased active assailant training. The other one I don't have listed here, but in some conversations with them is equipment. Now trying to equip firefighters with ballistic gear. I mean, I think the law enforcement, I think Sheriff's Department has on the agenda later today, the Bureau of Justice Assistance Grant for body armor, but that's only for police. A set of high-end tactical gear and helmets can cost $3,500 a person to outfit them. So it's an expense, and many fire departments, some of them are equipping them with that, but all of them do not have that. Interagency coordination is mentioned. Integrating active assailant response and rescue task force training between sheriff and fire. That's one that sounds simple. But again, you have a law enforcement agency, a large one, the police has multiple jurisdictions. They generally work 8-hour shifts. You have fire departments, many of them work 24-hour shifts. Paid on call, Oxford I know uses paid on call to supplement. So a lot of times their training is at night or on weekends versus, others it's during the day. So they are hurdles that can be overcome, but it's not as simple as just saying, okay, next week, let's go do the training together. Because it is complicated and it is expensive and it takes a serious commitment. Increased joint training exercise with police, fire, and EMS. We sponsor some of those. We certainly encourage some of those. So our discussion has been, is there a way that we can increase these even more? How do we get better participation? We have a kind of a core number of communities that routinely participate in these exercises, but how can we find ways to get the communities that aren't routinely participating to join in? So those are some of the things we're looking at. Adopt a countywide active assailants response plan. I've started talking with the groups. There's 2 main fire groups in Oakland County, maybe it's 3201 and 3202. I've already met with 3201 and had some of this discussion with them. Have a meeting later this month with 3202 to try to get them. You can have the outline of a policy that can be for everyone and still allow for some specifics for your agency. And then work with law enforcement as well to try to get buy-in from all these groups to have coordinated response, because it is going to be mutual aid. Regardless of where it's at, there's going to be multiple agencies involved. So where do we go from here? I've touched on a couple of these, but recovery centers. It was about 2 weeks before the first counseling center was up and running after Oxford. We had some trouble coordinating with us and sheriffs and OCHN and other ones involved, but we're finally able to get there and in the end got a really good recovery center set up. But we did learn some lessons from there. At the splash pad, it was up and running the next morning. But we'll continue to still, even from Rochester, okay, we got it up and running, but what pieces weren't there? How can we be better at it? Schools, I've mentioned, we've been working really hard with that, but continue to look at some of these recommendations with schools and how do we get schools. Reunification, it's very different in talking about minors in schools than it is for a business or Pine Knob or one of those places. So working with them on reunification plans. Excuse me, again, how do we have some consistency with that? What are the areas that our office can support to help make it consistent across the county? Training and exercise, incident command, high-risk unified incident command. There's been so much turnover in public safety agencies after COVID and that getting command trained in that. Right now we've been running 4 classes a year of ICS 300 and 400, which is incident command training. That's 40 hours of training. That means those agencies giving people up for 40 hours. You know, again, the sheriff's department tries to do all that. They were doing many of theirs internally because that's the best way they could manage it. But knowing that integration was a problem, our last class, they sent people to the integrated class. So they're working to integrate their command staff in the command training with others from outside the sheriff's office. As well as high-risk unified command. There's a course developed through OCTAC and Jim Edson that many of you may have seen before that has done a lot around the world with active assailant, runs a high-risk unified command class, which is really looking at high-risk events and how, well, it can be challenging. How do you get unified command in those events? So how can we support that to expand that training? How can we make sure that all the agencies are participating in that? So those are some of the things we're looking at, again, with working on the reunification process. So that's something that we're starting to work on. You know, this after action was a big financial commitment by you and the county. What we need to make sure is that the return on investment is there for that money. That's not something we'll be able to answer next week or even next year probably. But it is something that we need to make sure that we keep at the top so that that investment pays off both frankly for here and how that, unfortunately, I'd love to say that the chances are we won't have one again, but we already thought that and we had a second one. So, and the reality is the lessons you learn from these help in everyday incidents that maybe don't get the media or that kind of attention. So my goal and what I felt my charges from you and it was from the county executive is where do we go from, how do we take these things from here and make this investment worth it? So that will be one of our main focuses and goals going forward.
Thank you. Commissioner Powell?
Was there any feedback as far as like safety in the schools? Was it encouraged to get, I don't know, I know we got in-school officers. Resource officers, thank you. But like, was it like metal detectors? I mean, cause I grew up with them in Pontiac, so.
No.
That was just to say, but I was just wondering, was that something that came up and was any of the schools inclined? And if not, I'm interested to understand why they wouldn't want such things in the school after something happened.
It was not a focus here, and at my direction, the company was not to focus on the school. We knew we did not have the funding. The school, they did an after-action report, which was good. Especially now when the AG was starting to talk about investigation, we struggled to get some basics on school interaction with law enforcement and fire, because that part was important for us.
Okay, so
But we did not focus on the school's actions or school safety.
But they
at all.
they did put an action report together, right? The
Yes,
school did? Okay, now Spears, was that stuff that they looked into moving forward, or was it a con to metal detectors and stuff like that in the school for safety?
I think they looked at multiple options on how to best improve it. And I
They
think
looked
they're
at
still
that. One of their focuses, and you'll see on our agenda later today, was behavioral threat assessment and management and properly using that, which I'll continue to push and hammer on as a way to not have to respond to these. But yeah, there was a pretty extensive look at the school and their processes as well.
Thank you, I was just wondering, thank you. Thank you, Chair.
Commissioner Spitz?
Thank you, Madam Chair. Thank you, Tom, for going through this. I don't know if you've all have read it, but I read it. I probably should read it again because it's pretty thick.
I've read it twice and I need to read it about 5 more
Yeah,
times.
just to get all the information that's in there. And a couple things stood out to me. One, you guys are working on relative to the integration with the schools and improving that communication. As you said, communication is always big in any type of issue in any field, communication is always number one.
Yes.
Always number one.
Especially now.
Right, and finding ways to improve that is, something I wish we could do much
Mind-boggling.
faster. What I'd like to see, and I don't know if Tom and the administration probably talking about this, from a timing perspective, like the last two, facilitate countywide policy adoption, countywide, is there timing set to some of those things that are bigger picture type of items that we're gonna say, I'd be okay with 2027, we're looking to have that done, something like that.
An exact timeline, no. What I've discussed with Rob is with reunification, I wanna see an outline before the end of this year of how we intend to kind of work through this plan, which will then also give me a timeline. Now, my hope is that next year, we can work with all these people and by the end of the year, we have a good outline of a reunification process that works, again, not just with schools, but for any type of activist sale event. But I will say it is a little bit generic. That's what I'd ask them to give me, is that kind of timeline by the end of the year.
Okay. And I'd like to make a request of both your team, the administration and the board commissioners here is they'd like to come back maybe no less than on an annual basis to get an update on how we're progressing in all these topics that I know you guys are working on, just so we get a good idea and we can answer to the public with some of the questions they may or may not have, right? And my final point and comment, and the big thing that stuck out to me in reading this is training. You touched on it multiple times there, but I think it actually brought up multiple times within the report itself is training in general. And I think one of the big things that, I've been pushing for a long time through OCHN, CIT training, which unfortunately it all comes down to this.
It does.
Funding. School resource officers always comes down to this. I've been a big proponent of school resource officer in every school we have, but nobody wants to put up the money to make it happen. Which is frustrating to a degree, because it is all about safety for our children. But one thing I'd like to ask the Board of Commissioners and my colleagues is training. We've been in discussion about a training center for years. We're talking about new buildings for the Water Resource Commissioner, we're talking about buildings in downtown Pontiac, we're talking about some other buildings. I would really request you to really consider us creating a training center here in Oakland County, not only for our Sheriff's Department, but for EMS, for the entire county, so that we can have these training sessions at that location, be consistent, be in line so that we're all on the same page. And I would actually hope that it would expand outside of the county too, if we could actually get there. Because to me, that is huge, and from a cost perspective, if we have a facility, you're not requiring each of these entities to go out on their own and try to find one here, and there, and that always costs extra money. That would help drive down the cost to a degree if we could do that. So it's something I'm asking that you all please consider going forward.
And one of the challenges I mentioned there is, it's been a struggle the last few years, as you all know, just for hiring. The police and fire, EMS are all running short staff. So now if you're already at minimum staffing numbers, to send anybody to do the training means if you're gonna send one of those people, now you're having to backfill that with overtime, or you're having to pay people overtime. So just staff time can be a challenge for them. When we do a full-scale exercise, we only do one every 3 years, and part of that is it's not even just hundreds, it's in the thousands of hours in preparation and time and commitment and all that. So it can be a very large commitment to get, they're important and we have to do them, but time is always the other really big challenge. And again, I mentioned it, police and fire do different work schedules, so it's finding ways creatively to work through that, but many of these jurisdictions are struggling with their budget to have the funding to send that many people to training, so it's finding a way to do that.
Facility make it easier.
Thank you.
Takes out one issue. Thank you.
Any other questions or comments? All right, thank you, Tom. We need a motion to receive and
So
file
moved.
this report.
So moved.
A motion by Commissioner Spitz, support from Commissioner Powell.
You have 5 yeas and 0.
Thank
Alright, thank you.
Next time.
Thank you, Tom. Our next presentation is from Oakland Community Health Network. And we have Trish and Dana here with a presentation.
Yes. Good morning. Thank you for allowing us this opportunity to present to you, and thank you for your years of support. The reason we can sit here and show and highlight some of the programs is because of the collaboration and partnership, and also the involvement of several of you with our boards and our committees. So I wanted to thank you before we start. Today we're here to talk about our comprehensive behavioral health crisis services for the community and the transition of those services from OCHN. So the first part of my presentation is pretty routine, and I'm sure several of you have already heard it. So I will try to go very quickly through that portion so we can get into the meat of why we're here today. So you know OCHN is a community-based local public mental health behavioral health system, and we're funded as a PIHP and a CMHSP through the state of Michigan. Those are prepaid health plans, and those are our community mental health specialty programs. And our prime population of service, or the people we serve the most, are people with serious mental illness, children with serious emotional disorders, people with intellectual developmental disabilities, infant mental health, as well as autism and substance use disorder. So we are publicly funded, as I said, and most of the people we serve either have Medicaid, are uninsured, or underinsured, meaning that the coverage they have don't cover their behavioral health benefits. So we serve about 30,000 people a year. That number continues to grow. I think after the pandemic, I think the one thing, and I've heard this said before, and I've said it myself, is that we have the positive thing is that we've brought attention to mental health and behavioral health needs of our community. And people are really speaking out about their needs and seeking help for their concerns. So as a PIHP, and we use a lot of acronyms. If I mention one and I didn't explain what it is, please let me know. I try to make sure I use all the words, but it's a pretty big title. We oversee the funds, like I said, through the state of Michigan, through the Center of Medicaid and Medicare Services, CMS, for behavioral health care, public community behavioral health here in Oakland County. We're one of 10 prepaid inpatient health plans, right? For now. We don't know what that's gonna look like probably a year from now, but just to be transparent, for now, this is what we are. For the next year or so, this is what we are. We manage the Medicaid funding. We also contract as a CMHSP with our network providers, and also as a CMHSP, we are able to provide direct services. And we know that that concerns some of our providers within our network, but our goal is to work with our providers and not be in competition. The sad part about it is that there's enough people that need services that we're not really competing with one another at all, because we can serve people in need, and there are people who are knocking at our doors to get those services and support. So we drive the system planning. As you know, we have an annual plan, and we also have a 3-year strategic plan, very similar to what this county does. So the funds follow the people, not the programs, and we are responsible for making sure that those programs are provided, that we're the safety net for the community. And as a CMHSP, a community mental health service provider system, we lead the Oakland County's delivery of behavioral health services. That means case management, that means direct services such as therapies. And we have a full array of Medicaid covered services, probably about 146, my last count. And that means that we have to ensure that those services are available and our system has a capacity to serve individuals who need those things. That means conducting assessments, treatment planning, care coordination, coordinating a crisis response, which this is a perfect segue to what we just heard, as well as follow-up and stabilization services. We promote recovery, we promote independence, and we promote community inclusion, meaning we want people to lead their lives in the best possible ways, in the way in which is less restrictive than any other thing. So if you look at that map is proposed to change, and I don't want to get too far into that because it's very complicated, but the 10 PIHPs and the 46 CMHSPs will be changing. So that means there'll be, what they're proposing is 3 regional entities. So upper northern area, the central part of the state, and then the metro region, which is Detroit, Wayne, Macomb, and Oakland. So that's the proposed change, but we're really here to talk about our crisis system, right? So we lead Oakland County's crisis care, and we're responsible for ensuring there's a 24/7 response to anybody in crisis. That means access services in terms of calling and asking for help and having a place to go and someone to talk to. That means mobile response, and that is an area we know we definitely can improve. And we'll talk about some of the ways that we have in gaps with your help and your assistance, crisis stabilization, as well as crisis residential services as well. So we have integrated our crisis response in many ways over the last few years. And this has been a primary goal of OCHN, even when I first came into this role, was really to expand access and improve and enhance our crisis service response, to create a system, a continuum of crisis care. And so we've done that in several ways. Some of the ways were in response to tragedies, as we've just heard as well. But some of the ways are really making sure that people really have a place to go who may not be in full-blown crisis, but need an urgent response to what their needs are. Or they are in crisis and we want to help them as quickly as possible and get them engaged in the service and care that they need. So what you've seen in the last few years are co-responders, our clinicians who ride along with law enforcement in the community, and we've had great outcomes for that. Our crisis intervention team training, the CIT. Critical incident stress management is probably one of those things that came after actually Oxford. And we have trained clinicians and trained professionals who actually go in and support individuals when they've experienced a tragedy or a critical incident. Also, our behavioral threat assessment and management, BTAM, which is really led by our chief medical officer in terms of really making sure that we can prevent some of the tragedies we've seen in the last few years by doing an assessment and managing and making sure that we can prevent any harm to people. Hospital liaisons. We knew that people were waiting in hospital EDs. When somebody goes to an emergency department with a psychiatric crisis and not a health condition that needs to be addressed, they often end up waiting, especially our children. So in response to that, we reinitiated something that was a part of our system many years ago, hospital liaison. So anybody waiting in a hospital emergency department more than 24 hours, if they're approaching 24 hours, which is a long time to wait, right? If you have a broken arm, that's a long time to wait. So imagine a child that's having a psychiatric or a behavioral health crisis. We want to make sure that those instances, those cases where people and family are waiting for services, we're figuring out what the barriers are and getting them moved as quickly as possible. And so we've seen great turnaround. Along with that, we have our youth family care connections, which is also a part of our crisis continuum, which also is located at our resource and crisis center. And what we've seen is a diversion of kids who are coming in crises, being able to treat them very quickly and have them return to the community and engage in care in the community. And it has reduced the hospitalization of children. So we really are proud of those programs that we have. Not perfect, but they have responded to some of the needs that we have in our community. The school mental health navigators, thank you. I see the faces who were around the table when we presented this a few years ago, have been, we've gotten such tremendous feedback on the work that they're doing in terms of being in several schools. And when we developed this program, and Rudy Hobbs was here as a deputy exec at the time, it was for all schools, and it was for the purpose of making sure that families knew how to connect and get those supports and resources for behavioral health care needs that they were seeking. And it's for administrators, it's for teachers, it's for anybody in the school system who needs the support, who may have a question, who may need a referral, who may need help with coordinating care. Because we know sometimes people with commercial or private insurance have a challenge as well. And so we weren't discriminating against anybody. We weren't singling out any group of people because of the payer. We were really looking at the need of the community. And our veterans navigators, which I've been told, and I'm pretty proud of, we have the best in the state. And I've heard that from the state. So we have veterans navigators, and in fact, we have an event this weekend,
Tuesday.
and it's in our parking lot in Troy, and you'll be able to send families and veterans families and the community to get resources and support. So again, we've built our crisis system. We've really built in filling in gaps. You also will see where we have additional access points. We have staff sitting in Southfield at the the Oakland County Health Department in Southfield. So they told us, hey, we get people who are coming in here seeking help, but sometimes they need behavioral health assistance. So we have someone actually there who can help and connect people to that level of care. And then also with the Care 360.
Oakland 360 Care Connect.
Thank you. All these
Center.
names I told you. And so with that partnership with Honor Health as well as the Oakland County Health Department, we were able to open up what I would call an integrated urgent care, honestly. We call it a walk-in center with our partnership with Honor because they are also FQHC, a federally qualified health clinic. But it truly is an integrated urgent care where people can go and there's no distinction. You're being screened, what is your need? We can connect them to those resources, those social service resources, as well as behavioral health and physical health. So we're really proud of that. And then very quickly, our goal really is to ensure timely, compassionate, and effective support when someone is in crisis. So if you think about a wheel, you can think about any one of us always being on this circle, right? Where we're looking at early intervention, prevention, treatment, and recovery. So at which time we can make sure that there's always a level of care. That is my watch barking, I'm
Okay.
sorry, I thought it had it on
It's okay.
silent. But we can always look at somebody to ensure that they're getting the most appropriate care, someone to contact, someone to talk to, somewhere to go. And then the other really critical piece is coordinating care. There's no wrong door in making sure that people are not turned away. People have connected to services, they're engaged in services, there's warm transfers. We really want to make sure that people get what they need when they're coming into contact and need behavioral health care services. And I think my last slide is the purpose. The purpose, we've been asked, why are you doing this? Really, the purpose is better coordination of care across the system, having a full continuum of crisis care, which is at several levels. We have routine care, urgent care, and emergency care. Faster response time, streamlining referrals, enhanced follow-up and aftercare. Really making sure if somebody contacts us and they're in crisis, or even if they need routine care, did they land where they were supposed to land? Are they engaged? Because often if you see the situations of tragedies and things that have happened in our community, it's because in some cases, people were not in care and families did not know what to do to get them engaged or re-engaged. We want stronger accountability and oversight, and then also having a unified experience for people in crisis. So knowing where to go and what to do and how they're going to be helped, and it aligns with the statewide crisis delivery system. And so we're working very closely with the state, making sure that we're able to meet the new standards that are coming out for crisis stabilization units and things of that nature. So this is something that we've been building up to for several years, but also this is something that we have a transition plan. We're hoping to work very closely with Common Ground, and Trish will take it from there and fill in some of the gaps.
All right, so you should all have a copy of that transition plan. I know I emailed it a few weeks ago as well, along with some additional handouts that are all available on our crisis transition website, which I will cover at the end. But let's talk a little bit about how we got here. So this really started with our 3-year strategic plan, and that started back in January and February when we launched our needs assessment. We had annual community forums for the community and partners to give input into that, as well as multiple presentations to our board on what those strategic plans and our fiscal year 26 plan was, which is included in both of those plans. Oh, I can click, it's okay, thank you. We began discussions with our current provider right now in May of 2025 to discuss the fiscal year 26 transition for full implementation by fiscal year 27. We sent official notice in June by letter, and we had continued meeting until the beginning of October. I'm really happy to know that we have re-engaged in those conversations, and we have a meeting on Thursday again with our partners. You'll see in the transition plan that you have, that's a little bit more detailed, but we are in phase 1 currently. We will begin in winter of 2026 to transition what we call the front of the house. This is our front desk, the lobby, crisis assessment services, along with the sober support unit, all at our building here on the campus, the Resource and Crisis Center. That will move into spring with the transition of mobile crisis and focus on that community-based response. And finally, summer and beginning of fall, the end of the fiscal year, transition of the crisis helpline, which is not the same thing as 988. That is a separate contract. As a CMHSP, we are required to have a crisis helpline and those stabilization services. So we have had some questions about what exactly will transfer. So not everything that is done at Common Ground is funded by OCHN. This will only affect OCHN funded services that we are responsible for. So that includes the walk-in crisis assessment and facilitation, mobile crisis services, which is a little bit different than our co-responders. So our co-responders are master's level clinicians that are embedded with our law enforcement agencies. Mobile crisis is a licensed clinician with a certified peer that respond without law enforcement. The crisis helpline that I had mentioned earlier, as well as the stabilization services, which is short-term up to 72 hours of intensive support, and then along with crisis residential services, which is an alternative voluntary up to 14 days for those in crisis. I really want to focus on our commitment to excellence and continuity. This is not just for our crisis services. This is really across all of the programs for OCHN, but really focusing on the continuity of care during this transition. That's something that's one of our primary goals is for the individuals that we serve. Providing that service excellence, looking at staff training, emphasizing customer service. When individuals walk into the RCC, unfortunately, they're not walking in on their best day, right? And this is what I tell my officers as well. Unfortunately, you're not interacting with somebody when they're having their best day ever. And so we really want to be able to provide them that warm and safe place to land when they're coming in on probably one of the worst days of their life. Process improvement, as Dina mentioned, streamlining those operational workflows, and stakeholder engagement. Make sure I'm on the right slide. So we have been designated by MDHHS as the state sanctioned crisis service provider, so that is our responsibility. Our team has a lot of experience, both directly and indirectly, with the crisis system designed. And I actually did a little counting on the way over here. The leadership team that is leading this has over 100 years of experience within crisis response and inpatient. We want to make sure that we have full implementation with Crisis Now model and aligning to the SAMHSA guidelines, which is also part of your handouts as well. We have a phased approach to really ensure stability and reduce the stress on that, and how we can look at how we, baby step that through the year, as well as a comprehensive training program looking at the training provided to the individuals who will be providing that service, such as building on what they currently already receive, such as well, and then really building on that to make sure that we're delivering those services. And while we're talking about staffing, I will take this moment to plug our job fair on December 17th from 10 a.m. to 4 p.m. At the third floor at the Health Division, so that we can make sure that we're filling those positions with qualified staff. And I'll say that we do truly value the current staff that are there. We do welcome them. We've had a lot apply already, and really encourage them to apply within OCHN. So Dana mentioned again, over the past few years, we have been filling in those crisis gaps. So I won't go too much into CISM and core and CIT. Dana covered that really well. But this is what we have been focused on. And primarily in my prior life as Director of Justice, focused on the majority of these initiatives as well. And I will turn it back over to Dana.
So we'll talk a little bit about the financial and community impact. And one of the biggest things, we know there will be a cost incurred with training and hiring and retaining the current staff if they are to stay with us. But our goal really is to make this transition budget neutral as much as possible in terms of, that is why, one of the reasons why we're doing a phased approach, not only just to check and balance what we're doing as we're doing it, but also to make sure that as we transition those services, we're transitioning to serve the people with that funding as well. So we look at stakeholder feedback and the communication we receive from you all, as well as several during our board meetings and board commissioners meetings. We're always listening in to see where are the questions coming from, what are the things that we can do to better communicate what we're doing and how we're going about it, and getting the support from the people who are gonna really need those services and hearing from those individuals as well. We also wanna be transparent as possible with my board as well as with this board, letting you know what's going on as it's going on, and bringing back progress reports and telling you all of it, not just the things that are going well, because sometimes we just hear about the good stuff, but we also need to know about the challenges so that you can have that in terms of responding to any questions you may get as well. And then again, part of this transition includes a real communications plan about how we keep people informed, how we let people know how this change is going to impact them. But again, the goal really is to make it as seamless as possible and to make sure that people continue to be served without any gaps in care. And so that is really what we focus on. We work very directly with our Citizens Advisory Council, our Recipient Rights Advisory Committee, as well as others like BEST, which is the Begin Ending Stigma Now or Today group, and other empowerment groups and strategy groups. We have a very active committee list of people who are engaged in giving us feedback all the time, and we take that feedback very seriously. Building a stronger system together. Again, I wanna focus on the crisis continuum of care. And it's not just one location or one place. It really is, where do people find the help that they need, the support they need throughout the community? But also, how do we make their response here at the Resource and Crisis Center better? And how do we ensure that people are connected to the care that they need in a timely fashion? So we want to make sure that people are being supported throughout their path in receiving those services. We want to strengthen and continue to strengthen our partnership. We're really proud of the partnerships we've built over the last few years, and we continue to work with our hospital partners who we know we all will be probably very negatively impacted by some of the changes on the federal level with Medicaid and things of that nature. So we want to make sure that we're prepared for that. Also expanding direct service capacity. So it's not, again, I want to emphasize, it's not to put our providers out of business or to take service lines from our providers. It really is to fill any gaps that may be there and make sure that we have the capacity as a safety net to serve people when they come into care. We don't want people waiting. We want to make sure that they can get into care and be seen as quickly as possible and connected to those services. And with that, that is it. And there's our contact information. I think all of you in this room know how to get us when you need us. And please, any questions or concerns you may have, we're happy to take those.
Commissioner Powell?
So last week, me and Lenny was on the call with MAC.
Okay.
And MAC is actually, they applied to be a PHP. Okay, can you help us kind of understand, like, how is MAC able to, I mean, we supposed to check on our end, but I want to, this was a question I was gonna bring to you anyway, Dana,
Yes.
to understand.
Oh, yeah.
And then with all y'all changes, 2 questions, so that,
Okay.
and then the second question, with all these changes, with them still changing,
Mhm.
is that gonna affect this transition? Possibly.
Perfect. So with the MAC, we found out about that probably in the last month or so. We were hearing things, there are so many rumors, but we did hear and we have confirmation that they did apply to be one, or respond to the bid, right, to be one of the regional entities. They applied for the entire state, so those 10 prepaid inpatient health plans will now be 3. This is the proposal, right? And the MAC is proposing that they would be the one regional entity for the state who would operate as we do as a PIHP.
In partnership with Raymond.
Yes, in partnership with Raymond.
Which region would they be though? Or is they to be the?
All 3, all 10.
Oh, to be over all
The
3?
entire state. So they want to be the one entity for the entire state.
That's crazy. Okay.
So we're hearing so many different things, and I don't know if you all are aware that there's a court date next week on the 8th and the 9th, right? I have to look at Francis. Where the judge is deciding in a hearing where we had a lawsuit, not us directly, but a couple of the PIHPs and CMHAs have sued the state for this RFP, saying they weren't allowed to do certain things, and it really cut quite a few of us out to be able to bid. And I'm not sure if you all are aware, I think you may be aware, but it was a few months ago. Everything's going really quickly, but we did apply and submit a bid to continue to be the regional entity. We did it as a single county, right, as we are now, but we also did it in partnership with Macomb County. So with that, the way this RFP is written, it probably is very unlikely that we would get one or the other. I think we're probably better off to get a joint partnership with Macomb, and that would change how we look as a PIHP. That means we would have to be responsible for the entire region, which would include Macomb, Oakland, and Detroit-Wayne, which is a big thing to take on. And I think if you look at it, and not to be too controversial, but the PIHP really is the Medicaid arm of it. That's the $450 million budget that we have, almost $1 billion budget that Detroit-Wayne has, and probably $350 million that Macomb has. Those are Medicaid dollars. So as a CMHSP, that's where our local general fund dollars are. And so that would reduce our budget drastically to about 20 million, maybe a little more, a little less. But we would remain, regardless of the outcome with the PIHP rebid, contract, and lawsuits, as a CMHSP, which would mean we would still be responsible for ensuring the full array of Medicaid services are available, including those crisis services. So some of these things would have to be changed in law. Some of these things would have to be changed as the Michigan Mental Health Code. So there's so much entangled in this. That's word I can come up with right now. But there's so many things involved in this that we're really building a bus or a train or a plane as we go along, and trying to reinforce those services so that there is no fallout or no gap in care for the people we're responsible for, regardless of what it turns out to be. But we know we'll be a CMHSP, but the PIHP may change or it may not, depending on what the judge rules next week. But the other piece of that is that the state is due to make a decision as well next week in response to those bids that were submitted. And I think if that happens and several who have applied are not granted a contract, there'll be more lawsuits. So this could go on for a long time. And so we really want to make sure that nobody is harmed in this transition, this reform, this thing.
Okay, and then I have one more question. When you use the statement, how did we get here? Just, if you was talking to a high school student, simple as term, how did we get here to where now common ground has to be, now you may have explained it, but this is, I'm trying to understand my understanding. how did we get here where Common Ground now has to come under OCHN? Just how did that happen with the state change? Like, what was that about?
They've always come under OCHN.
Okay.
Common Ground is our contracted vendor for crisis services.
Got it, okay.
And so what this says is that we'll no longer contract with Common Ground for those services. The things that will remain I think, are critical to what we just heard from the Emergency Management Office, and that is the resiliency centers or recovery centers. Those are still a product and are supported by Common Ground.
Okay.
Some of the other things, the victims assistance and those programs will stay with Common Ground. We're
Got
not
it. Oh, okay,
taking any of those. 988 is another part of that. Those things
Okay.
still remain.
okay,
And they will still provide crisis services in other communities if they're contracted to do so.
got it.
But in Michigan, as a CMHSP, we're the only ones right now who have contracted out our crisis services.
Got it, okay.
We're getting in line to where we should have been, but we're also had this in the works for a while now.
Okay. And then my last question, just one more. Medicaid. So my sister was told by a doctor's office that there's a Medicaid cap in certain communities. And I said, how is that? How can you cap if people need Medicaid in your area? And she's in the Lake Orion area. And so she's been seeking out doctors all the way in Clarkston because we have doctor offices saying, oh, we're capping, there's a cap on Medicaid. How can you turn a Medicaid patient away? Or do doctor offices have that discretion to do that? Oh, they do, okay, that's it.
They can accept Medicaid or not, and the problem is Medicaid is a payer last resort, and Medicaid is a low payer
Got it, okay,
compared to commercial insurances and things of that nature. They can pay a higher rate.
got it, okay, thank you.
But if she
that's
needs
one of
help
the
finding a
struggles of-
provider.
Oh, no,
Yeah.
she's fine, you know I would've been called you, Trish,
Okay.
But when she said that, I was like, dang, they got a cap on Medicaid in certain communities.
There's
She's
a
like,
lot
yeah, I
of-
gotta go all the
lot
way to
of folks that
Clarkston.
want
I'm like, oh,
Medicaid.
I know it's the back far, I know, but she from Pontiac, she live in Lake Orion, now she, that's like, it's not, but, yeah, okay, thank you.
Any other questions, Commissioner Spitz?
Thank you, Madam Chair. Thank you, ladies, for coming out. Taking a look at your transition plan, since that seems to be one of the hot topics that's been out there. I do appreciate the phased-in approach, because to me, that makes sense. One of the questions I have is the 15-day joint service transition. How did you come up with 15 days? Because it's just my initial thought, and I'm not an expert anywhere in this field, just other transitions I've seen. It seems small, it seems low for 15 days.
I will tell you, our hope was that we would have the 3 months between October and December to do a lot of the transition, and then each program is the side-by-side for 15 days. So that's not, the full transition is not in 15 days. There'd be a lot of pre-planning and everything prior to,
Training.
before that.
You're expecting a lot of upfront work to be done before that 15-day transition,
Yes.
15-day joint transition.
Yes.
Because that's where Common Ground and you guys would work together for 15 days.
In that specific
to train-
department,
In that
with those
specific plan
staff,
for
yeah.
that phased-in approach,
Yes.
let's say.
yes.
Okay.
So it wouldn't be
Is that-
just 2 weeks.
Is that
So I
15
think that's a little.
15 calendar days then, not 15 business days? Or is every day a business day in your work?
Every day is a working 24/7.
It is a
I figured,
20, so
okay.
yeah.
Just wanted to make sure.
There would be a lot of, the prior 3 months was the initial of getting everything set up so that we would be ready to go with those 15 days.
Right, and if I read this correctly too, at each different phase, there's a 90-day period for people to apply for positions that are transitioning within that.
Yes,
Phased-in
we wanted
approach.
to start the hiring process and give it a few months, so we have multiple positions open now for phase 1 and 2 throughout.
And that would be the opportunity for anybody at Common Ground to
Yes.
apply for those positions that might be transitioning into OCHN.
Yep, so
Okay,
that's on our
thank you.
website now, and then we have.
I just wanna make sure that it was out there.
Yes,
Yeah.
and then the job fair on December 17th from 10 a.m.
I hear that, cause you guys put out reports and plans, but not everybody always takes the time and read through them, right?
Yes,
Those are the
yes.
details.
Well, and then the other thing I think is not apparent to many is that we already work side by side. Our access team is already working in the RCC and right alongside a Common Ground. So as well as our Youth and Family Care Connection. So we've already integrated and work very closely together now.
And one final question, if I may, Madam Chair. Common Ground made a comment about their contract at our last meeting. That they still hadn't signed the existing contract to work with OCHN. Are you guys working through those details to make sure that
We are.
they have a contract that is fair and equitable to both parties?
Yes,
Yes.
so they signed their fiscal year 25 contract on October 20th
Right.
of this fiscal year. And so part of our meeting with them on Thursday is how do we move forward with a fiscal year 26 contract or month to month on the fiscal year 25, and what does that look like, so.
Thank you.
Commissioner Erickson Gall?
Thank you, Chair. Thank you for this presentation, it's very helpful. I know I've been hearing from state legislators, and I imagine other commissioners are as well. And it's my understanding that you have at least recently been reaching out to them to discuss this transition with them. And I thank you for doing that, and I hope you continue to do that. Because the feedback I'm getting from state legislatures is not particularly positive, so I'm hoping and they're reaching out to me because they think I have some sort of control over OCHN, which we don't have any direct control over that, so but please continue to keep those lines of communication open because they do have some ability to directly impact what you do. And I think it's important that they're comfortable with this transition.
And if you saw my calendar, this week you'd be very proud. So Monday, tomorrow, every day this week, I think I'm working with legislators. And we've gotten some great responses in doing just that. I think you're right. Lessons learned, honestly, we own that. And we should have really put this out to the legislators and to you all, probably much louder than we did. So
Thank you.
Thank you. Thank you for that feedback.
All right, thank you for the clear and concise information in your presentation. So I need a motion to receive and file. I have a motion by Commissioner Powell, support from Commissioner Spiz.
Thank you.
Thank you for being with us.
5 yeas and 0 nays.
All right. We've had our presentations, we've accepted the material. We move on to communications. There are 9 items under communications. 3 are grant applications, 3 are grant acceptances, 2 are amendments, and 1 is the Marine Division 2025 summary. So the grant applications are for the Paul Coverdale Forensic Science Improvement Program, to Enbridge for the Safe Community Responder Program, to Michigan Association for Local Public Health for the Local Public Health 2026 program. Grant acceptances are for the fiscal year 2026 Michigan Drug Court Program, Michigan Veterans Treatment Court Program, and the Veterans Court Program. The amendments are to the fiscal year 2025 Michigan Mental Health Court Grant Program from the State Court Administrative Office. Another amendment to the Virtual Backlog Response Docket Program for 2024. Who would like to make a motion? A motion by Commissioner Powell.
I'll support.
And I have support from Commissioner Taylor. Does anybody have questions on the communications?
Wasn't there one for Marine Division too? Did you mention?
I did say
You
the
did
last
mention, okay.
one. Marine Division 2025 summary.
I'm good.
Any questions or comments? Would you prompt the vote, please?
You have 5 yeas and 0 nays.
All right, thank you. Our communications are approved. We move on to circuit court recommendations. There are a number of circuit court recommendations also, and we have Chris Bujak here to talk about that. Our recommendations are more grant acceptances. First for the Child Parent Legal Representation Program, 2026 Michigan Drug Court Program, 2026 Juvenile Drug Court Program, 2026 Juvenile Mental Health Court Program, 2026 Veterans Treatment Court Program, the grant acceptance from the 2026 Edward Byrne Memorial Justice Program. And the last is an amendment from Probate Court, memo of understanding with OCHN and the Oakland County Probate Board. Would like to have a motion by Commissioner Erickson Gall and support from Commissioner Powell. So we are ready for you to begin talking about these items.
I will be very brief. You've already seen these grants in action over the last few years, so there is nothing new here. Just for highlights, you'll notice the CPLR grant though is less this year, only because they based it on our 2-year ago spending, which we only started in the last quarter of that year. So they have told us, once we accept this award, we can ask for additional funds and they will make them available. Last year, we received 200 and some thousand in reimbursement to the county for this grant, and I expect we'll be at a similar number this year. So we will be going back to ask for additional funding on that. Their initial award was for 100,000, because that's all we spent the very first year in '24. The Adult Treatment Court. They reduced their award this year. SCAO received less money. They had less money to give out. And you'll notice really the ATC and the Byrne go hand in hand in funding our Adult Treatment Court. Our Adult Treatment Court, as of this morning, had 105 participants. Those 105 individuals would be over at Oakland County Jail. The majority of them would be in the jail today if it weren't for the Adult Treatment Court program. So they would be costing the county $160 a piece every day of the year for $16,800 a day the county saves by running our Adult Treatment Court program. I plan on coming back in January. We have enough to keep the positions funded that we have, but I don't have enough between those two grants to keep the staffing level for our OCHN contracts. And quite honestly, we've been running over 100 participants for several years now, and it is very difficult to do without additional staff. We could not afford to keep the program going without the OCHN support. And quite honestly, we had hoped to find a part-timer this year to help with the program. So I plan on coming back to ask for roughly $200,000 in January. I just want to let you know. But in the big picture, the county saves about $6 million a year by running this program. And it improves the lives of individuals within our community by helping them obtain sobriety. So just food for thought. Our juvenile drug court grant, we is pretty much the same as it has been for many years. We received a similar award. It funds part of a position and helps children who are drug addicted. Juvenile mental health court, again, similar award, slightly less than last year, but we should have enough to get by with the program. Our Veterans Treatment Court award was less. We do think we can get by this year on what they gave us, but we have been, there is another entity that has contributed to funding that program that will not be able to do anymore. They have done like incentives and things for the participants. We will lose them after this year. Their funds will be gone. So for next year, we may need to ask you for money for veterans.
How much is that?
The Veterans Treatment Court,
How much are you losing?
I think it's probably around $15,000 a year. It's not a lot. You know,
Okay.
it's the kind of thing that
Check.
You could.
but it's such an important program. And I know you wouldn't want to lose it for that. So again, we received less this year. I don't think we need to ask for more in anywhere but the ATC from you. Our interlocal agreement, we're just extending that agreement for another year with OCHN. They have a requirement to provide within, I think it's 33 days, a treatment plan for any time there's an involuntary mental health treatment order from the probate court. So we need to keep that agreement in place to continue that service. I think that's everything. And I
Great,
don't
thank
envy you the rest of your agenda today.
That had to be fixed.
But thank you, these are, as you said earlier, these are items we've seen before, so Perhaps questions will be at a minimum.
Sure, can I say one more thing too, for all of you who may know, you may have been involved when they approved it, but thank you for the, construction has begun on the ADA compliant bathrooms for our jurors. And so that construction is happening right now. Thank you for your support in that, and all of the citizens who come to serve on jury duty will appreciate that.
Thank you.
Thank you. Any other comments? All right, would you prompt a vote, please?
You have 5 yeas and 0 nays.
All right,
Thank you very much.
thank you. Yeah, 5 items under district court recommendations. They are all grant acceptances. First from the 2026 Michigan Drug Court Sobriety Program. The second, Michigan Drug Court Program. The DWI Court Program, the Mental Health Court Program, and the Drug Court Program. These are, I'm saying the same words, they're from just the different courts. One in Troy, one in Novi, one in Clarkston, 3 in Novi. Who would like to make a
Question
motion?
by our farm.
I have a motion from Commissioner Taylor and support from Commissioner Powell. And welcome to you to talk about these items.
Thank you. I'm Alexandra Black from 52-1 in Novi.
And I'm Paula Mueller from 52-1 in Novi.
It's weirdly high.
It's a chair.
So,
Position of power.
just like Chris said, there, we have a lot of, the same, all of these grants are the same. We don't have anything new for you here today. We had asked for more money in our mental health court grant. We mentioned that last time we were here that we were going to do that. We did not receive that money. We were trying to get another OCHN liaison in addition to the one that we already have that supports our program. We got enough money to continue the position that we have with OCHN liaison, but we didn't get another sum for the probation officer and liaison that we wanted to add to expand the program. But we're grateful for what we did get, so we can continue the great work that mental health court is doing. That I believe is like $116,000 or something like that. That's going to cover the salary, some travel, training, and then some things for the participants themselves. To help support their testing and any kind of tether, anything that we need to assign them to do that would cost a lot of money. In our veteran treatment court program, we only asked for a small amount. It's all of that money. I believe it was like a little over $6,000 that we received. All of that money is going to go back to the participants for various things, graduation, for their incentives, rides, different things that we provide for them. The DWI, our drug, our sobriety court, which we call DWI court now. Same thing, we don't support a position with the monies. All of the monies go back for conference and mainly for the participants to support them. And then our drug court program, we did receive enough money to fund the probation officer that runs the program, but not enough to help support the participants. So we're gonna ask for a reallocation like we have every year from SCAO. We've never been turned down because we, really can support why we need more money, and I understand that they're trying to make people more responsible in the money that they're asking for. So that's our plan, is to go back for reallocation to get some money to support the participants better in that program. But we continue to have great success. We've had, actually we had some commissioners come to our last graduation, which I really appreciated, and I think they enjoyed it. You guys are all welcome to any of our graduations. We do send the invites via email. I know it's kind of hard to get a lot of things, but if you ever feel like coming and you can see all your great work. I'm not pointing at anybody in particular, but all of you could come and see all your great work. So thank you very much. That's pretty much it. I don't want to take up too much time.
Thank you. Well, we have Carol and Patricia
From
on
52,
video also. Is there
From 52.
Hello, Carol Bond. I'm the Deputy Court Administrator at 52-2 District Court in Clarkston.
And I'm Nadia Mlinek. I'm Probation Supervisor of 52-2 District Court.
We are just asking for acceptance for our grant to continue some of the work we're doing with our sobriety court program in the amount of $12,288, which is just slightly more than we received last year. And that's going to the participants who cannot afford their own drug testing, for some incentives, graduation gifts, and for team training so that we can maintain compliance with the state requirements.
Thank you.
Thank you.
Patricia, do you want to talk about Troy?
What Alex and Carol said. We received $139,890. So we were happy about that. It's more than last year, not as much as we asked for, but same things. It'll cover peer recovery coach, counseling, testing, incentives, and attendance at a training.
Thank you. Are there any questions about these items? Would you prompt the vote?
You have 5 yeas and 0 nays.
Thank you.
All right.
Come see our good things.
Safe travels back.
Thank you.
Thank you.
We have one item from Emergency Management. It's a grant amendment to the 2025 Hazardous Materials Emergency Preparedness Grant from the Michigan Department of State Police. We have a motion by Commissioner Smith, support from Commissioner Taylor. And we have Bob and Angie here to talk about these items.
Good morning. So we came to you in October and did an acceptance for this grant. It was $11,550. What happens is we do offsite response plans for all of our tier 2 sites, with all of our chemical producing sites in Oakland County. Those offsite response plans, we either do new ones for new producers or review the old ones. Those plans then go to the state, and the state determines when they get all the plans from the state. They have one pool of money and they determine what money then goes back to the counties. So their estimate at the beginning was $11,550. When they did their numbers, it came out to $20,176.83 with a match of 25%, which is covered by a staff member. The money is then going to be used for training and exercises and paying for the subscription costs for Eagle's Tier 2 manager, which is what we're required to use for that reporting.
Thank you. Are there questions regarding this item? Would you prompt the vote?
You have 5 yeas and 0 nays.
Motion carried.
Thank you very much.
Thank you.
Our next 14 items are from Health and Human Services. We have a few grant acceptances. We have an agreement with McKenna for the Critical Home Repair Program. We have another grant from the Organization Capacity Building Program, amendment with OCHN for Pontiac Integrated Health Walk-in Clinic. Actually, there are 2 amendments. Another agreement with the Pontiac Integrated Urgent Care in Corktown in Oakland County. Amendment to the 2026 Emerging Threats Local Health Department Agreement. We have a grant acceptance from the Great Lakes and Energy for the 2026 Local Health Department reimbursement. An agreement with our Women, Infant, Children Program and Peer Counseling Services. Another agreement with the Ryan White Treatment Extension Act of 2009. And the last item is a memo of understanding with the Health Department for the Nurse Loan Repayment Program. Who would like to make a motion? I have a motion by Commissioner Powell, support from Commissioner Taylor. And we have many people here. We'll talk about this. We'll start with Khadijah and Kate.
Good afternoon, Commissioners. Thank you. So yes, for our first item on our long list, it is for the acceptance of a $500,000 grant from the Michigan Department of Health and Human Services to be able to do lead abatement in homes where children have tested with high elevated blood levels. What's exciting about this grant opportunity is that it is a partnership between our neighborhood and housing team and our health team working together to identify those children who test positive and are at risk, and to then be able to get into those homes to service them and do the abatement work to create a safe environment. And so it is for $500,000 for the current fiscal year. The grant goes until September 30th of 2026, and would allow us to abate up to 10 homes within the time period that we have allotted through September.
Thank you. We'll keep moving on. If one of the commissioners has a question about an item, they're welcome to ask. But the next item is the Environmental Justice Impact Program.
Yes, so this grant is also for acceptance of another $500,000 grant. This one obviously being through the Michigan Department of Environmental, Great Lakes, and Energy. And this one is very similar to the MDHHS grant. It is a partnership, once again, between neighborhood and housing, our health team, once again identifying homes that come in through our home improvement program who have lead, and then making sure that we use these grant dollars to do abatement for that lead. This grant does go until September of 2027. It still targets between 8 and 10 homes annually, and we'll also just make sure that as the two teams are working together, the time that is put towards the abatement, those hours will be supported through the NHD staff team. There's no new positions created for either of these, and so it's using existing positions in partnership.
Yeah, Commissioner Spitz.
Thank you, Madam Chair. How you doing, Khadija? I have a generic question. Because you mentioned the first one was 5 homes, so that's about 50 grand a home. The second one was 8 to 10, so it's probably around 40 grand a home. What are the values of these homes that we're doing this abatement in? Because they're gotta be old homes that still have lead. I'm thinking that because logically, if we're putting 50 grand into a home that's worth less than 50 grand, wouldn't it be cheaper to take that 50 grand and move somebody to a newer home using that money versus, I don't think that's within the law, but versus putting $50,000 into a house that's not worth $50,000.
Yeah, so with the homes that we've done, we haven't identified the homes for this project obviously yet, so you never really know, who will come through or what the value will be. But I guess I would say that with home values right now, it's been pretty hard to find things, in the $50,000 range or less. You are correct that the abatement allows up to, $40,000, $50,000 if needed, and we do recognize that abatement needs can range. With our team, sometimes the cost is really closer to $20,000. So I can't exactly answer the home value question at the moment. But certainly we want to make sure that safety is priority one. So I think, cost to families or to children who are being lead poisoned, that's really where we want to just focus.
I fully support what we're doing. It's not in question. It's just.
Yeah, just making sure. I think it's more expensive to try and figure out other housing arrangements because, we know that we're going as quick as possible to identify safe, affordable housing. But, even though sometimes these values of these homes are not high, the cost of doing the abatement and keeping families safe is actually cheaper than some of the work you have to do with relocation. And I see my team is on too, so I think maybe Cal first. Did you want to chime in on that
I guess my only request, maybe it's something we could track in the future going forward, because to me, it's something that I'd be interested in and understanding. And just keep thinking out loud, if I'm in a home that's maybe worth $60,000, $70,000, but it's gonna cost me 50 grand to do it, I'd rather give the homeowner 50 grand and say, hey, go find a new house.
Yeah, no, I think that's a valid, very great point. So we'll make sure that we are tracking as we go through it, with each homes, and can certainly provide an update and a report to you all as we go through this process, which is exciting because it's really a long time coming to be able to partner together, health and housing. So I think we'll have some interesting data points and things lessons learned through this.
So this grant is for staffing, not for the actual work of removing the lead from the 6 to 10 homes?
So actually, the majority of the grant funds are actually for the abatement work, the cost of the homes. Very, very minimal amounts are for staffing. So for the MDHHS grant, I think it's around 32,000, and for the Eagle grant, I think it's about 38,000. Because this is already processes and work that the teams are doing, you know, through home improvement. So really, the cost of these grants is really being passed on to make sure that we're being able to pay our contractors for the actual abatement work and making the spaces in the homes safe for the residents and the families.
Thank you, that's what I wanted to hear.
Well, I hope that's.
Okay, next item.
Okay, so the next two items are for an extension of the date and deadline on two ARPA projects that we operate through NHD. So the first one is the Critical Home Repair Program under contract with Habitat for Humanity. And the second one is the same project, Critical Home Repair, operated under McKenna. This is just a request to not change anything with our funding or any amendment on that portion of the budget, but just to make the date in alignment with the other ARPA projects to extend it until September of 2026 for them to continue the great work. Both of these projects provide critical home repairs to targeting those who are 62 and older and qualified census tracts. And so both projects are on track to spend down the funds, and this is just a date extension until September.
Thank you. Commissioner Powell?
So with these critical home repairs and then the funding that we just put aside for seniors, critical home repair that we just passed in our budget, where are we at with that one? And then in these two, were people from all over Oakland County able to apply for these too? Or what? Because I actually, and I'm gonna ask now, but I need a meeting with staff in y'all department so I get clarity as to when Pontiac moved their monies back to the city, like what they qualify for and what not, because I was told with the one we just passed, for any senior in Oakland County to get some assistance that don't qualify for our regular home improvement program, that certain communities can't even benefit from it. So I need clarity on that, because it was something that I proposed for my community to benefit, because most of the people that we've been getting complaints from has been from the city of Pontiac. And then for me to be told, after I implemented, co-sponsored this bill, this resolution, that folks from Pontiac can't even qualify for it. So I just need that to be a sidebar meeting, but where these critical home, is this for anybody in Oakland County, these two that we're talking about right now?
Yeah, so the two that we're talking about right now do have designated communities that applied for the fund. So Habitat for Humanity is a designated provider for Pontiac. And then the designated provider for the other locations are through McKenna. Curtis, could you share, I guess, kind of that list of communities?
Sure.
And this was the communities who opted in and applied for it. So.
And so it's going to be for census tract within the communities. And for the McKenna, it's going to be Royal Oak Township, Hazel Park, and I believe there was one small census tract in Troy.
Okay.
That were eligible for the roof transfer repairs.
Okay. And then the one for Habitat for Humanity was just all Pontiac?
Yes.
It was the majority of Pontiac census tracts. There were a couple that were eligible.
Oh, okay.
But it's the vast majority of the census tracts in the city of Pontiac.
Okay. And then I'll get a meeting with you all for the new resolution we just passed in this budget so I can get clarity, because I gotta figure out a way that really it was for anybody in Oakland County. I just didn't know we was eliminating certain communities. So I need to go back to that resolution.
So Commissioner, just to kind of clarify, I know we talked really quick in passing. It's not that they're eliminated. It was just that when people come to the door for those programs, it's through CDBG or home. And so we just need to make sure that there's clarity with the program guidelines for those communities who operate their own community development block grant or home repair programs. So we'll still be able to serve those who are 62 and older in Pontiac. It's just that it's going to have to be a different process because we're not operating the CDBG and home grant funded programs in Pontiac or a few other communities
So
as
is
well.
it good for me to just follow up with Curtis Smith? Because he called me about some other stuff this morning. Will he be the point person with dealing with all of that?
Yeah, absolutely. And of course, you know, I'm available as always too, but Curtis oversees the home improvement program.
Yeah, you be busy though. So let me bug Curtis.
You all.
No, you're always available, but let me bug Curtis. So thank you for that clarity.
Thank you.
All right, next item is the organization capacity building program.
All right, so mine are the next several items, which is why I'm remote, because I needed all of these papers to keep myself organized. So the Health Division is requesting to accept a grant from the Michigan Health Endowment Fund for $178,000. It's a capacity building grant that we will put toward enhancing our data stewardship committee and our work that we're doing with our public facing dashboards and creating data standards and a data governance policy. And it looks like we will be subcontracting with a data consultant to help us evaluate best practices and standards. And we've worked a lot of training into that budget for the data stewardship committee on the dashboards, Power BI, and other data visualization tools. Any questions on that?
Doesn't look like it. We'll move on to the.
Okay, so if we could combine F, G, and H all together, because they're all about the integrated urgent care, the Oakland 360 Care Center. And so F is the amendment to, F is the Oakland Community Health Network amendment. And G is an amendment to honor, and H is bringing in Corktown Health. So let me talk about this a little bit. At this point where we are in the opening, in the grand opening of the Oakland 360 Care Center, we're at a point where we're incorporating the Penske funds into the original state funding and the ARPA funds. So we're reevaluating who is getting money from which pot. And so because we've got the Penske funds coming on to help with a lot of the behavioral health needs, we're reducing what OCHN will get from the state funds. And so that's that first amendment there. So OCHN will get more funding from the Penske Foundation, which you'll see that at the next board meeting. The next one with honor, it's a little bit of a bump up from the original $3 million, again, just because they won't be getting the Penske money, but OCHN will. And just to accommodate some of the building renovations as well that we've been working on. Corktown Health is a new partner that we're pulling into the Oakland 360 Care Center model so that we have coverage on the south end of the county. Looking at the data and the zip codes that of the patients that are coming into the care center, we can see that they're traveling a long way to get to us. And we'd really like to expand our services toward the south end of the county to provide better access for residents across the area. And so we're bringing in Corktown Health into care. And Corktown is an integrated care center themselves already. So they do provide behavioral health care, they provide primary care and dental on site in their new building in Hazel Park, which will be opening this month. So that's where you'll see we're giving them $500,000 to help open up that center and build the capacity to have extended hours in the same model that we're following in Pontiac. I hope those three made sense together.
They do. Any questions? Commissioner Erickson Gall.
Thank you, Chair. Yes, I'm very excited about the partnership with Corktown. I had the opportunity to attend an event there recently and got kind of a sneak preview of their facility, and it's beautiful. And so I was and they also mentioned that they were partnering with the county. So very, very excited about that and grateful that we're going to have that presence on the south end of the county because somebody shouldn't have to travel from that area all the way up to Pontiac to be able to take advantage of this. So thank you.
Thank you.
Thank you so much. I appreciate it. When I saw the facility, the first thing in my mind was this would be an amazing integrated urgent care It's a beautiful space. I encourage everyone to visit it. We'll let you know when we're fully launching there. Shall I move on to I?
Yes.
The Emerging Threats Agreement. All right, so good news is we are receiving an additional $100,000 under this grant, and so it is moving us up to $338,000, and the additional $100,000 is for the ELC Regional Lab funding. So that's funding that we were expecting, it just didn't come until this first amendment. And that just allows our laboratory to continue all of its amazing work that we're doing.
Thank you.
No problem. And, okay.
Next amendment to the health department.
Local comprehensive, all right. So this is a big one because I definitely felt that there were many programs missing from the local comprehensive agreement when I brought it to you this summer. And so it was originally 13.5 million, and now we're finally back up to that 15.1 million, which includes programs that had been left out. So you can see the list, but it's the adolescent STI screening, the CARGOS project, which is what's the combating antimicrobial resistant gonorrhea and other STIs. That's a really cool CDC project that we have going. The disease intervention specialist workforce, emerging threats, Hep C, HIV PrEP, HIV prevention, the regional health advisory councils, STI control, and STI prepaid testing, which is new for us. So our laboratory is receiving this $25,000 actually through the state. It's funding that typically we would send STI tests to the state lab. And so rather than sending them to the state lab, we'll be sending them, or regional partners can send them to our lab, and our laboratory will be paid to do that testing. So this is, again, funding that we were expecting, and it didn't come until this first amendment.
Thank you.
Thank you.
All right, we'll move on to the 2026 Health Department Reimbursement Program.
This is changing gears a little bit to environmental health. So this is our funding from EGLE, and it's in the amount of $674,418. And this really covers our programming for drinking water, pools, campgrounds, and septic. And again, that's a reimbursement agreement.
Thank you.
All right. The subrecipient agreement for OLSA's WIC program is the next item on the agenda. So this is a long-standing agreement. We've had this agreement with OLSA for over 20 years. Their award is $604,000, and this allows them to service WIC clients in 5 different locations across the county.
Thank you.
All right, so the Ryan White HIV/AIDS Treatment Extension Act program. So I'm sure you're aware, but Ryan White funds cover HIV care and treatment. And the City of Detroit Health Department is actually the recipient of the Ryan White Part A funding. And so this emergency relief grant supports Lapeer, Macomb, Monroe, Oakland, St. Clair, and Wayne. And so this agreement doesn't establish a transfer of funds. It's just an interlocal agreement, basically recognizing our partnership and our support of their programming that do service over 3,000 Oakland County residents every year.
Thank you.
Okay, last one. The Nurse Loan Repayment Program is an exciting topic. Actually, we're requesting approval for a memorandum of agreement. This is at no cost to the county, but this is an opportunity for nurses to receive loan repayment. And for the first time ever, Michigan Department of Health and Human Services has determined that local health departments are eligible work sites for nurses to receive this reimbursement. And so typically nurses have to work in an area of critical shortage, nursing shortage, an area of critical need to be eligible for this program, and local health departments are finally eligible work sites. And so we actually have 3 nurses that have eligible loans and have been approved to participate in this program. And so we are requesting permission to sign this memorandum of agreement with NDHHS, with the Nursing Loan Repayment Program.
You are correct. This is exciting. It's new, and we'd love to continue to see more of it.
Thank you.
All right. Any questions or comments regarding any of the health and human service items? Would you prompt the vote, please?
You have 5 yeas and 0 nays.
Motion carries. Thank you for all for your
Thank you.
We move on to Sheriff's Office recommendations. The first is a grant application for the fiscal year 2025 Bulletproof Vest Partnership Program. The next is an acceptance for the Emergency Response Support Program for the Rochester Hills Splash Pad shooting. The next is an amendment to the agreement with OCHN for the Behavioral Threat Assessment Program. And the last is an interlocal agreement for participation with the Oakland County Sheriff's Office Sheriff Search and Rescue Team. So I have a motion by Commissioner Spiz and support from Commissioner Powell. So welcome.
Thank you, good afternoon. Gail Pierce, Sheriff Fiscal Officer, and I have Lieutenant Brian Burwell with me today. The first item is our annual Bulletproof Vest Partnership Program grant application. We're on a 5-year replacement schedule for our vests, so each year we apply for roughly 20% of what our total would be. This year we're applying for a little over $178,000. We know we're not gonna get that much, but we always, shoot for the moon. Typically our awards have ranged over the years from $0 to $43,000, so we're hoping for somewhere in between that range. And obviously we'll be back for the acceptance. The next item is new funding with OCHN, and it's creating a one dispatch specialist position to assist with our peer support program. So the funding will cover the position, overtime training, mileage, cell phone, and computer costs, as well as the ability to purchase or create a digital mental wellness program for our office. And that's obviously in response to the ongoing response to the Rochester Hills splash pad shooting. So kind of like the other one that we have with from the Oxford shooting, that we have positions that are ongoing peer support. This one is for the splash pad. The next item is also with OCHN, and I think they mentioned it earlier, the BTAM program, which is Behavioral Threat Assessment. This one is just a restructuring of the personnel. So I don't know if Tom wants to join us on this one.
Tom Marcy, this is the Sheriff's Office, nice to handle the paperwork in this one. We're the sub-recipient with OCHN for a partnership BTAM team. So there's been a full-time sheriff staff. The grant also allowed for a full-time OCHN and a part-time in our office. So we've been working with two of those. OCHN has been working to try to fill their spot. It's a very narrow field. Had some struggles there, so after some discussions, going back and forth between us, we talked about sharing. Do they hire him part-time and us part-time? Neither one of our corp councils really liked that one. So the thought was we would hire him full-time and he would work part of his time actually on behalf of OCHN. It's all one team working on behavioral threat assessment, but helping with some of the office and the pieces on their end. This is through April, so it seems short-term, but OCHN has already received another grant that will continue these positions after that. Behavioral threat assessment, internally, our county team here at the workplace is multiplied cases by three times each of the 2 years we've had it. We're now working in partnership with OCHN and the sheriff on community. Where can we support schools or businesses or others with behavioral threat assessment? So it's continuing to develop that.
What exactly do you do for the behavioral threat?
The idea of behavioral threat assessment is, if you look at the research, almost everyone, the only case I've ever read that didn't have an indicator ahead of time was the Las Vegas shooting. There are people around them that give off indicators that something is going on. Many times it's a mental health crisis, it's other things that are going on. But it's a process to intervene in that, figure out what's going on, and try to get the resources to the person to get them off that pathway of violence before it happens. So we don't need the grant for recovery, that we can try to head these things off ahead of time.
So are you given notice by a teacher or a parent, is that how?
So, for example, in the workplace team that we have multiple ways people can report. They can report anonymously through a submitted form. We get phone calls, we get emails. And the community team that we're starting, sometimes it's a case, there might be a kid that's moved from school to school to school. And at the moment, he doesn't have a home school, so there's no school team that's necessarily paying attention. So in one case, I know it was a request from the prosecutor's office to provide some assistance on feedback. So the recommendations in the community come from various sources. And then the team can also be a resource. Different school systems at different places are at different levels and comforts with their team, because we now have been in place for a few years, have some experience. If we can be a resource to help them develop their teams or to help give them some feedback on a difficult case, we do that.
Thank you.
Okay, and our last item is just a formality. It's another interlocal agreement. Oakland Township Fire Department has asked to join our sheriff search and rescue team. So you're just approving an interlocal agreement for them today.
All right, thank you. Any questions regarding these items? Would you prompt the vote, please?
You have 5 yeas and 0 nays.
We can ask a bunch of
Motion
questions.
carries, thank you.
Thank you for your support.
Thank you.
Our next item is a Board of Commissioner recommendation. It's a resolution reaffirming ongoing commitment to the Stepping Up initiative to reduce the number of people with mental illnesses in jail. So this has no money attached to it. It's simply saying we as a board agree that working with people with mental illnesses in jails is a priority for us, and that OCHM has established its resource and crisis center, which helps people stay out of jail. Yes, thank you. So I have a motion by Commissioner Taylor and support from Commissioner Erickson Gold. Commissioner Powell, do you have a question?
No, I just was saying that I'm happy that we, keeping our eyes on this going on in our jails. As we've been told by our sheriffs themselves, we know that we have a high percentage of individuals who are dealing in the mental health space who are currently in there. So I'm just happy that we're offering the right resources to assist them while they're in there. So I'm happy we have this to keep an eye on that activity over there.
Agreed.
Thank you.
Thank you. Would you prompt the vote, please?
You have 5 yeas and 0 nays.
All right, motion carries. We are at public comment. Is there anyone from the public wishing to address this committee? You would come to the end of the table, state your name and community, and you have 3 minutes.
Hi guys, my name's Margaret Gupta, I'm with Oakland Township. I just got sat in and you guys did a lot of grants for the circuit court, looking at juvenile justice, looking at a bunch of different things. Zoom hearing platform was a grant that you guys had to follow through with. There is no oversight on the circuit court other than the AG, and when the AG, nobody investigates fraud on the court that's committed by court officers and everybody that's shown action to cover it up, conceal, suppress. All of those are criminal actions. In February, this coming year, it'll be 4 years. That's a long time to be waiting for justice when an arbitrator can alter emails, not be held accountable. Then a judge is able to, corrupt 5 different Zoom hearings. That's unacceptable. You guys have the responsibility because you guys funded the licenses. You're funding the security. People are allowed to go into the judge's chambers, get into their computer systems, get into the Zoom license, to get to a court record to change it. And nobody's listened to me. There's the whole part about fair justice, right? How can fair justice be delivered when a Zoom hearing platform is being used as an instrument to change court records, to remove statements, to rig cases, to control the case outcome? And there's no ability for a public person to even confirm the originality or the authenticity of the court record. Zoom hearing records generate two. There's a video file and an audio file. Both of them are corrupted. Nobody in Oakland County has investigated. Nobody wants to. The whole part they say is case closed, case closed. That's all they say is case closed. Why? Because there are no documents, there's no files, there's no records. Black and white. This is, Ms. Gupta has alleged fraud in the court back on July 13th, 2022. And then I got completely snuffed by 5 agencies. Even the regional state court administrator, even the state court administrator, they all know. That nobody's done anything to change it. Nobody's done anything to stop it. Nobody's done anything to fix it. And when I asked the county clerk, hey, can I fix my statements? Oh, let's go to corporate counsel. Corporate counsel says, case closed. You guys didn't know about it. You guys have the opportunity to say what's going on. Because the county has been made to take the fall. You guys enact the system, you thought it was secure. You guys have been given a Trojan horse. And now when all this comes up and I start making noise, you guys are gonna be on the fall for it if you guys don't take action. Right now, nobody's taking action. No one wants to because there's so many people involved. And I've got the receipts. They know it. So I hope somebody listens to me and I need some action. Thank you.
Thank you. Thank you. Is there anyone else for public? Yes, thank you.
Good afternoon, ladies and gentlemen. My name is Dave, Birmingham, Michigan. I'm a disabled vet of 15 years, 3 tours. I've been working at the Sober Support Unit in Common Ground for the past 2.5 years. And I'm here to bring awareness of the tension and uneasiness that is continue and ongoing within the RCC. I understand, read all the plan, and it's great, but it says nothing about retention and current employees. We don't know what's going on. We don't know how everything is going to happen. You're mentioning about the 15-day plan. Like, when does that 15-day start? Does it start February 1st? Does it start before that? All these things just lead into a lot of the just uncertainty. A lot of this uncertainty and tension that all of us, to include OCHN employees within the RCC, it's affecting how we do our job. It affects how we do our job. It affects the overall goal, which is to improve community services. So overall, I just want, maybe all of us in this room can come together and come with a definitive plan that we can put out to everyone that is providing face-to-face crisis services. That'd be great. Thank you.
Thank you. Yes, your turn.
Good morning, afternoon, good afternoon, everybody. My name is Andrew Doyle. I'm a first responder in Oakland County, 14 years in EMS. Was a part of the Oxford School shooting response. This is something that's always been on my heart. I did work for 2 years at a police department in Georgia. At that police department, we had a civilian unit that supported the officers and deputies, where we could handle less critical calls, freeing up the officers for more urgent needs. So now coming back to Michigan, I would like to see something like this implemented either as a unit within the sheriff's office that I could help build, or, as a private entity that could contract with local municipalities to provide support for the officers and deputies. Things that we could do, like for instance, I was certified in traffic incident management. So instead of having 4 or 5 officers tied up directing traffic, our units would go and take that over, freeing up the officers or deputies to respond to other things. So if I'm allowed to, I'd like to pass out a couple things to everybody, just so you guys can have it, and then just start planting the seed for making this a possibility in the future.
Yes, yes, please pass it out. Thank you. Thank you.
Thank you. Thank you, everyone, for your time on that.
Well, thank you for waiting with us.
It was good. It's the first time I've been to a commissioners meeting, so.
I didn't catch your name, I'm sorry.
Andrew Doyle.
Oh, I did catch it, oh, thank you.
Peter.
made enough copies.
All right. Anyone else for public comment?
Woo, Andrew went through some steps.
Public comment is closed. There is no other business to come before this committee, so we are adjourned at 12:33. Thank you, everyone.
Thank you.